Because the World Health Organization says by 2030, road accidents will be the 5th leading causes of death worldwide. And as we conclude the UN's Global Road Safety Week, the Anglo-American Foundation has launched the Limpopo Road Safety Program.
It's aimed at curbing pedestrian and road accidents in the province. For more on this, we're joined by Anglo-American Socio-Economic Development and Collaborative Regional Development Principal. They go by the name of Lishoka Ndyamba. A very good morning to you, Lishoka. Thank you so much for joining us. I mean, you know, when we come from the Easter break, when we come from the festive break, we're always hit with these very, saddening numbers that hit, they always get up every year. You know, there's never, I think the only time that the numbers have not hit the roof was during COVID. And that's because, well, we kind of were not really allowed to be on the roads too much. But when we came back, and I don't want to say came back from COVID because it's still there, but when we came back from, the grips of COVID-19, you saw the numbers going back up once again. So how important is it to ensure that by the time we get to 2030, South Africa at least is not among those countries that are leading in terms of road deaths?
Absolutely. Good morning and thank you for having me. I think the road incident fatalities linked to either speeding is quite a detrimental aspect that is occurring within our society, particularly when we look at the Limpopo province, which in comparison to other provinces has the highest rate of road incidents. And one of the contributing factors linked to this is speeding. So there's definitely a key need for interventions such as the road safety program to try and curb the plight that is currently linking to behavioral aspects as well as road maintenance infrastructure that is required within the Limpopo road network system.
Well, Lishoka, then there is something clearly that we're not getting right. It's either people are refusing to listen to the messaging, or we have to seriously deal with the factors that are, contributing to people, irrespective of messaging, still choosing to speed. I mean, there are road signs that say drive 120 kilometers per hour, in some instances 100 kilometers per hour. And if people are not necessarily adhering to that and are still insisting on driving way beyond that, that means that somebody's deliberately not paying attention to the messaging. And I'm trying to figure out why so. If my life is at stake by speeding, surely I should be listening to that. And if while you're answering that one, Lishoka, may I just ask that you also turn on your video so that we can have a visual of you this morning. But something's going wrong here with the way that we are receiving this messaging if we're not listening to it.
No, that's very accurate. And I think it's for this reason that we are taking the stance to use the safe systems approach. The safe systems approach essentially, takes a major shift in the change in which road safety is addressed. It overturns the fatalistic view that road traffic injuries is the price to be paid for road mobility. So what we are essentially going to be using in this approach is a shift in mindset in how we think about road safety, as well as the actioning that is required to take road safety forward and reduce those road incidents. So we understand and we recognize through the safe system approach that road safety is a shared responsibility, and that humans, road users, as well as infrastructure needs to interact in a way that promotes a high level of road safety.
Lishoka, but how much education can you really give? Sometimes it's not a matter of people don't know. It's a case of people don't care. So you can teach me until you're pink in the face, but if I really couldn't be bothered, by following the rules because, I don't know, I've just bought myself a very new fast car and I want to show the guys, especially if I'm sitting with my friends in the car, I want to show the guys that, I know how to put pedal to the metal. And then on top of that, I'm doing it under the influence because, we're coming from a brine, maybe we're going to a second location and I need the guys to really feel it. And I feel a little more like, Lewis Hamilton when I'm sitting in that car under the influence of alcohol. So I know what I'm supposed to do and what I'm not supposed to do. I know that some of the roads, between Johannesburg and Polokwane are not really well maintained, but I couldn't be bothered because I'm sitting in this very beautiful fast car and my friends need to know.
No, that's very accurate. And I think what is great about this approach that we're undertaking for the road safety program is that we're going to make it context specific. So we are going to go as lower to the ground as we can to just understand particularly what are those challenges. There are 13 projects that we will be engaging in, but we want to get it right. And in order for us to do that, we will be taking a phased approach where we're going to prioritize 6 out of the 13 projects. 3 of those projects will cater to community road safety as well as behavioral change. We'll also take a look at road safety in schools, capacitating our public officials as well as officers, and also micro-enterprise for road maintenance. So it is an integrated approach, but absolutely, I think we need to really get to the core in terms of what are those psychosocial challenges that actually lead road users to go against the rules and regulations that are stipulated. But I think key to this is just understanding what are those behavioral challenges that are existing within our communities.
Yeah, it certainly is one of those conversations that we have to have a look at our socio-economic structure and perhaps how do we reconfigure, re-engineer the way that we think about utilizing the roads. But never mind the road users in terms of the actual vehicle owners, it's the pedestrians as well that are seemingly getting the brunt of it as well. But how then do we start extending even that messaging to the pedestrians? Because again, after a drunken night and you're walking with friends, you don't necessarily pay attention. And then there's this issue around visibility, right? A lot of the people that are using our roads, the pedestrians, are not visible. They're not wearing reflective jackets. They're not wearing anything that can be spotted. And unfortunately, they become victims of some of these road accidents simply because you just can't see them.
And these were pertinent questions that were raised during the launch last week. On the 9th of May, where the Department of Community Safety actually raised that challenge to say liquor stores are open, they are catering to substance abuse and allowing individuals to walk the roads while they are under the influence. This is certainly going to be a program that's going to require extensive engagement, extensive collaboration with industry role players, thought leaders in the space, so that we can put together a strategy that can actually speak to mitigating against these challenges.
Anglo-American Socio-Economic Development and Collaborative Regional Principal, of course, Lishoka Ndyamba. Thank you so much for joining us here on the South African Morning here on eNCA. Of course, it's important that these discussions need to be had, and it's encouraging to see so many stakeholders coming in and helping essentially the government to fight the scourge of road deaths, because we are coming up after winter, we're going into the summer period, and when we do, you guys are going to want to go show people just how powerful your cars are. And we would hope that you're listening to the likes of Lishoka Ndyamba, who essentially is saying that just drive safely, speed kills, arrive alive.
Yeah, absolutely. And I love what you were saying there about the guy that feels so powerful in that vehicle after a drunken night and going on to the second location. Because 21 to 24-year-olds actually, and then 25 to about 35-year-olds are the ones that are actually losing their lives on our roads. And if you look at the statistics, even released by RTMC, they say that black African men are the ones that are dying on the roads the most between the ages of 25 to 34 simply because of driver behavior. So we'll continue to really shed some light on some of those messaging.